Welcome to PT Microlessons, fast lessons with big impact. In this lesson, we're going to look at common upper GI conditions relevant to PT practice.
When we're trying to determine the cause of visceral symptoms, we're really using pattern recognition, not making a medical diagnosis. First, look at the location of pain or discomfort. That helps you narrow down the likely organ system. Next, consider symptom behavior when it occurs. Is it related to meals, activity, position, or time of day? Then, look at the key features. Sometimes this comes in recognizable patterns, or even a triad. For example, the classic GERD triad is heartburn, regurgitation, and symptoms that worsen after meals or when lying down. Not every condition may fit the triad approach, but it may help you quickly identify a condition. And finally, always screen for red flags, because they tell you when to refer.
Now, let's start with the location of GI pain. GI-related pain can present in a few predictable patterns. First, you may see local pain near the involved organ. This is visceral pain, and is often more diffuse or poorly localized. Second, pain can be referred to somatic regions that share the same innervation of a spinal segment. This is why patients may report pain away from the actual organ. For example, stomach pathology may refer to the thoracic spine. And third, if the organ irritates the diaphragm, pain can be referred to the shoulder region due to shared innervation via the phrenic nerve. Understanding these patterns helps you connect symptoms to the likely source. Now that we understand pain patterns, let's look at common upper GI conditions. These involve the mouth, esophagus, stomach, and duodenum. For this overview, we're going to focus on high-yield conditions commonly seen in clinical practice and on licensure exams: GERD, hiatal hernia, gastritis, and peptic ulcer disease. We'll use our framework to understand how each one presents. Let's apply our framework to gastroesophageal reflux disease, or GERD. GERD is the reflux of stomach contents into the esophagus. The pain is usually retrosternal, often described as heartburn, and may move up toward the throat. Symptoms are typically worse after meals, especially if they are large or fatty, and when lying flat or bending forward. Key features include acid reflux, regurgitation, and a sour taste, and sometimes even a chronic cough or hoarseness. Symptoms often improve with antacids, sitting upright or lying on the left side. Red flags would include difficulty or painful swallowing, weight loss, or signs of bleeding. The classic GERD triad is heartburn, regurgitation, and symptoms that worsen after meals or when lying down. A hiatal hernia occurs when part of the stomach moves up through the diaphragm into the thoracic cavity. Symptoms can look very similar to GERD, while some patients are asymptomatic. The key idea is that this is more of a structural issue which can contribute to GERD. Gastritis is inflammation of the stomach lining. Think of this as inflammation without a defined lesion, but in some cases it can progress along a spectrum toward ulcer formation. So since the presentation is similar to peptic ulcer disease, we will look at that next. Peptic ulcer disease is an open sore in the stomach or duodenum, most commonly associated with H. pylori infection or NSAID medication use. Pain is also epigastric, but typically more localized and burning. A key piece with peptic ulcers is meal timing. Gastric ulcers worsen after eating, while duodenal ulcers often improve after a meal. Symptoms can progress from mild nausea to a gnawing or burning epigastric pain, often with decreased appetite. As the condition worsens, watch for red flags that require referral: vomiting blood or coffee ground emesis, black tarry stools, fatigue from anemia, and weight loss.
That's it for this PT Microlesson. Like and follow at PT Microlessons for more fast lessons with big impact on physical therapy topics.